Hi, it's Paisley. Welcome. I'm also with our foster dog, Oliver, or Ollie, today. For this practice, you're going to want a block. If you don't own a block, we're going to actually be standing on it. So we want something stable. You could use like a big hardbound, like a cookbook or a reference book. Once you have that, we're going to begin lying down. And you just want to make sure that when you lie down, you have room to reach your arms overhead without running into anything. We're going to go legs bent, so that may help. Okay, so just get settled, lying down. And once you're positioned comfortably, let's just take 3 slow and conscious deep breaths. Try to just relax your back on this last breath here, just kind of releasing your weight down into the floor. And then I want you to notice the back of your body, the shape of your back, how it's touching the floor, and the placement of your rib cage, and how it is or isn't touching the floor. And we're going to add a simple arm movement with some reference to those points. So start by bringing your hands straight up above your shoulders with your palms facing toward your legs. Then very slowly, we're going to begin to bring the arms in the overhead plane. And as we go, we're going to try to keep the arms moving at the same rate. And what we're going to notice is if there's a tendency for the back to lift or narrow, to lift off the floor or narrow in order to get the arms to go overhead. We're not necessarily trying to get the fingernails to the floor. We're just trying to learn about the connection between the shoulders, the arms, and the middle of the body. Okay, bring the arms back up, right above the shoulders, fingers towards sky. Reset some relaxation in your back, kidneys, ribs, releasing down. And then again, slowly, no rush, not even the goal to reach to maximum, but instead to keep your rib cage from flaring up toward the ceiling, to keep your back neutral, broad across the mat. And noticing if you have a tendency normally for that area to compensate for perhaps tightness or restriction in your arms or shoulders. And then again, we're going to bring the hands up. And what you may notice if you are able to kind of lock the middle in place is that you'll stretch a different part of your arms or shoulders. So last time, slow and mindful. Keep the front ribs neutral. Try not to let them flare up. And pay attention to your middle back and try to keep that from lifting or narrowing or flying up. And then this time you're just going to hold whatever that apex where you can manage the arm stretch without that middle body changing, and just kind of reach through the line of the arms. Soften the brow. Take a breath. And then bring the hands back up. This time, you're going to place your hands on your thighs. As you exhale, crunch your front ribs down toward your hips and elevate your head in an abdominal action, lifting up, shoulders coming off the floor. And then release. We're going to put that arm stretch back into this shape. Neutral spine. Inhale, the arms come up. Exhale, reach the arms overhead. No disturbance to the middle of the body. So kind of a slow arm stretch. Inhale, arms to sky. All the way over to the thighs. And as you exhale and you curl up, don't let the pelvis shift in shape. Tail down, pelvis neutral, just bringing the upper part of the torso toward the legs. release. We're going to do it one more times. Inhale, arms up. Broad across the back. Exhale, arms overhead. Front ribs staying tucked in and neutral, but not so fiercely that you can't breathe. Last time, sweep the arms above the shoulders, down toward the legs. Try to keep the tail from tucking up. Pubic bone pushes out between the legs. Front ribs draw toward hips. Slide the hands toward the knees and hold. 3, 2, 1. Release. Big breath in. Out through the mouth. Roll to your side. And use your hands to help you make your way to sitting upright. Once you have come to upright, you're going to make your way to all fours. And just take just a couple of moments to move the spine like a cat and cow shape, just allowing some free form play to happen. No rules, just stretching and moving the body in any way that you want. From here, take your hands so that they're wide, a little wider than your shoulders, and then lift your knees and pike your hips up into dog pose. Step your feet wide as your mat, so we're going wide with the foundation, feet wide, hands wide. Bend your knees. Lean just a touch forward like you're coming out of the pose, like you're going to go to plank. And then lift your waistline, lift your ribs. Remember what it felt like to have the ribs in and the back broad as your arms were overhead. So as you begin to push the hips back and up and deepen the pose by leaning the chest closer to the knees, try not to let your ribs flare out or forward. And keep some breath across your back. It's the same thing we just did it. We've just flipped it upside down into dog pose. Don't worry about your legs getting all the way straight right now. Just try to get this connection between the rib cage, the back, and the arms in the overhead plane. Just keep the arms nice and stable. And then take one more breath. And you're going to begin to walk your feet forward, still wide, about as wide as your mat, and take the weight in the legs. You can keep the hands on the ground, or if you prefer, you can hold your elbows. Give a little micro bend to the knees. Lean your weight enough forward that you feel the backs of your legs begin to just tiny bit engage. And simultaneously release all the weight of the neck and shoulders down. Let's take one more breath. And then you're going to bend your knees. You're going to drop the hands, put the hands on the knees. Inhale, push into the legs like you're in a deep squat with the hands supporting on the legs. Pause as you exhale with the head upright, sort of a supported version of chair pose. And then stand. I'm going to step the feet just a touch closer, so about outer shoulder width apart. And as you come to standing, you're going to take this landmark, and you can use your fingers to help you if you want, but right here at the base of your jaw, at the top of your throat, that place, you're going to slide that back. And notice how as you slide that back and the sides of the neck come back and the head comes posterior, there's a lift that occurs in your sternum. That's your breastplate. So I want you to keep that elevation, the throat back, the sternum lifted. Turn your arms palm forward. And just as we've practiced twice now, begin to sweep your arms overhead and try not to let your back arch forward or your ribs flare open. It's okay if the rib cage elevates up toward the head, just don't let it go open toward the front too much. Now when you exhale, open the arms. As you swan dive forward, keep the head and the top of the throat back, pitch forward, and eventually you have to round the back. Just release the head and let it hang down. And touch the floor if you can. And it's always okay to just bend the knees a little bit if it's too strenuous for you. On the inhale, slide your hands to your shins, lengthen your spine. Lifting that same area, the hyoid bone is the landmark. It's a floating bone that's connected through connective tissue rather than bone-to-bone connection. Exhale, fold. I mean, technically all joints are connected with connective tissue, but it's kind of a funny little floating bone. So we're gonna do this twice more. Inhale, lengthen. So when you come to the halfway lift, bring your head back so that the base of your jaw lifts in line with the spine and you get that openness in the sternum. Exhale, fold. Let's do uno más, por favor. Inhale, expanding into the openness of the length you've created. And exhale. Now we're going to play with a funny shift of the foundation here. So it's not something normally done in yoga. Turn both feet to the right slightly. So it might be like 20 degrees, 10 degrees, not far. It doesn't have to be far. So your torso facing straight on your mat, both feet turn slightly to the right. Bend your right knee and let your hips go asymmetrical. So right hip drops down, left leg stays straight, right knee bent. Right hip drops down, left hip's kind of swinging up. And so we're shifting the foundation slightly in order to access different planes of the connective tissue, different lines of the connective tissue in the body. Most people will feel this more in the outer edge of the left leg rather than just the middle of the back of the leg. So it might be pretty intense. You can use your hands for any kind of support you need. And you just come to your breath and you move it through your body consciously. Lift up just enough to put your feet back to a more parallel position. They're still wide, like shoulder width, they're outer shoulder width. Exhale, forward fold, legs in a more neutral shape. And then again, we're going to bend the knees, put the hands on the knees, drop the butt, do like a supported chair pose, straight arms with the head up. Pause, dropping the buns down a little. Stand. When you come to your Tadasana, your standing pose, slide the top of the throat, the base of the jaw back. See how that can lift your sternum. And with the sternum, the ribs will elevate, but we're trying not to let them dump forward or scrunch and narrow the low back. Then palms forward. Inhale, reach. Again, the ribs not popping out, but they can go up, away from the hips. Exhale, forward fold. Touch the ground. We'll just take our halfway lift once this time. Inhale, slide the top of the ears back, the hyoid bone back, the throat back. Exhale, fold. And now feet turning slightly to the left. So they're not going to their maximum rotation. It's like 10 or 20 degrees maybe. And then bend the left knee, but keep the right leg straight. You can let the hips rotate as you do that. It'll be a little lower in the left hip, a little higher in the right hip, and you'll feel the outer line of connective tissue on the back of your leg. We're targeting a core line of connective tissue that goes from under the feet up the back of the leg, and we're actually going to target where it connects to the inner leg, through the belly, to the sternum, and all the way up to the hyoid bone. Okay, again, feet to center, facing forward. Inhale, lengthen, sliding the head and throat back so that the sternum moves forward, away from the hips. And this time when you exhale, just put your hands flat on the mat. and step into dog pose again, down dog. Now, we played with a wider foundation in the feet. Go to normal, whatever that is for you, and we're going to play with a narrower foundation in the arms. So walk your hands closer than you normally do. Maybe your thumbs are touching, or maybe they're an inch apart. And then bend your knees, lift your front ribs, broaden across the back of your ribs. You might have to come partially forward, almost out of the pose to do that. And then push back into the pose, moving chest towards knees without flaring the ribs or narrowing in the back of your waist. Just notice any differences from right to left or in this narrower hand position that we never do usually in yoga. But healthy connective tissue really benefits by moving in different planes and different vectors and not just doing the same thing every single time. So just try to hold that, maybe get the legs a little straighter, receiving this new input from a different landmark that you've created with hands and or feet. And then again, we're going to bring the legs forward, whatever distance feels good to you. Exhale, fold in. Bend knees, hands to tops of the knees. Straighten the arms with the knees bent. Lift the head, pause, exhale, hold. As you stand, just drop your hands. Come up slow. Have the head down for a while. Just let the brain and head repressurize. Okay, now that we're standing, it's when we're going to use this block or book or whatever you have. So I would suggest that you do this with some support like a wall for balance. And then you're gonna stand with one foot on the elevated surface. I'm using a wood yoga block. And the other foot dangling. And so what we're gonna do here is we're gonna keep the hip bones, the front hip bones level. Try not to let it drop down on one side or your hips sway out. So just hip bones level. And then we're going to begin to swing. So this is muscle energy that you're using to start the swing, the free leg. And then once you've got the leg going, stop using muscle effort and let gravity help kind of pendulum that leg and traction it at the hip joint. So do this a couple times. So get it going. And then let it slow down. But with the hips level, it's like it's growing toward the floor and making space around this psoas, upper inner thigh adductor connection. If you like that swinging action, you can just do that a couple more times. Or you can just pause and hold and let gravity pull the weight of your leg down away from your shoulder. Just check that you're not sagging in the hips, the hip bones are roughly level. And then just carefully step off your block or your book and stand on both legs and feel any comparison or noteworthy sensations. After which point you can do the other leg. So again, this line that we're working on, this is a core fascial line or train if you're into Tom Meyer's work. Stand up. It's one end of it is up here at the top of your jaw, the top of your throat, the base of your jaw. Slide that back until you feel your sternum lift, and that will sort of elevate your whole rib cage. You're not letting it flare forward, but you're going to begin to swing that second leg, the free leg, without letting the hips change. There's no like dipping down, like the hip bones are level, they're horizontal. And we're just trying to allow for that whole chain that moves down through the whole like breathing apparatus of the diaphragm into the psoas, into the pelvis, into the upper inner leg, kind of wraps behind the back of the leg a little at the adductor magnus, Goes down the posterior chain, past the back of the knee, all the way under the sole of the foot. So just give this leg enough time that it can have the same sense of traction that gravity hopefully can provide. Just check in with the posture, head, chest, ribs. And then step down again. That's it for the block, or the book, whatever you use. Just move it out of the way to the side. And then stand once more on your mat at hip width this time. And feel the lines of your body, the stacking up, throat and sternum connected through connective tissue. As you slide the throat back, the sternum lifts, the front ribs even pull up on the front hip bones. Inhale, arms go overhead without the back scrunching or narrowing or the belly flying forward. Exhale, forward bend. Touch the ground. On the in-breath, lengthen. Just pulling the spine away from the hips. Exhale, downward facing dog. Any hand orientation or foot orientation, don't be afraid to play with pivoting the feet one way or the other, or moving the hands to a different spot. It's good to switch it up. As you exhale, drop your knees. And then you're going to step forward with your right foot. I'm going to turn and face you for this one. So once you have that foot forward, you're going to bring your hands up onto your knee. You might want to pad your back or under knee for this. You're going to stay upright with the hips above the back knee. We're going to use the hands just for balance, so they can be in front, they can be on the leg, out to the side. And what we're going to begin to do with the front foot is we're going to begin to work on the springy resiliency of this line of connective tissue. So we're going to lift the heel and begin to do just little baby hops with this foot. And what you're thinking or trying to do as you do this is you're trying to do it quietly, delicately, almost like you're like a ninja and you're walking on rice paper and you're trying not to make any noise at all. And so that catching your foot as it lands, that's helping build up the springiness in the connective tissue. So as you do this, consider moving the foot wider as it lands, like past the line of the hip more laterally, and or narrower. So maybe it's slightly turned in or going across the midline. And somewhere in there, you're going to find a spot that you're going to be like, whoa, I've never stretched that like that. Pause there. And just hold it. And give yourself about 3 breaths and or any other plane changes, vector alignments of movement where maybe you don't normally go. As you take maybe your last breath here, just see if you can do that same little connection of head back, throat back, sternum up, front ribs in and up, pulling the front of the hip bones up as they go. And then release out of that. Simple step to change. So right leg down, left leg forward. We're staying fairly upright for this, so not going real deep in the lunge. Hands for balance. And begin to hop on the front leg. And it's not about how high you get that foot. It's about the springiness that you land with, that you come off and land with. And you're trying to do it gently, like delicately and quietly, And you're playing with different orientations of that front leg so that you hit different planes of your body. You might also get different balance points, of course. And as you move back and forth with that foot, or you continue your little hopping game, you might find a spot where you're like, yep, I'm gonna stay right there. And then you just hold that. This sort of springiness in the feet is one of the concepts that barefoot running is built on, is that it actually, that loading and springing of the joint ball of the foot first is helping make the tissue resilient. Let's take a last breath in wherever this shape has evolved to. And then you're going to release out of that. And you're going to come to sitting on your mat. And you're going to sit upright with your knees bent in front of you. We're going to roll down. But what we want to do as we roll down is make sure that we're not going to run into something. So just plan ahead. Once you're seated, situated, you're going to hold the front of your shins or knees. And this time we're going to actually purposefully round the back. So you're going to tuck your tail, you're going to roll your low back down. And as you roll down, you're going to drag your feet toward you until you get that little bit of balance point where your feet start to get lighter, or maybe you start to have a little wobbling. And then you're going to do your best to stay in this rounded shape and take the arms parallel to the ground, not holding the legs anymore. We're targeting the lower abs. Last time when we lifted up, we targeted the upper abs. So you can keep the legs as is, or consider stretching them on kind of a diagonal about the height of your head. This is a half boat pose. Hands can stay outstretched or come by the ears. We're going to hold for 3, like a canoe shape, arched, rounded. 2, 1. Roll down, head down. Knees to the hands, hands to the knees. Nice breath in. Take a twist with both knees to the side, one stacked on top of the other. Take your legs the other way when you're ready. And then once more back to center. Just give a little squeeze again. Are there any other things you need to do to prepare your body for just a moment of stillness? Oh, I learned recently that the connective tissue, the fascia, has 6 times more somatosensors, sensors that tell you about where your body is in space and how it feels. 6 times more of those than your muscles do. So when we think we're stretching our muscles and feeling our muscles, we're actually getting 6 times more information from the connective tissue. So as you stretch out into your shavasana and you rest for a little bit, you may feel like there's a lot more sensory information. Like some people feel a little bit like jittery or vibratory after a practice where we worked more purposefully with the connective tissue than usual. You'll feel however you feel. There's no right or wrong way. But let's just rest here. Don't skip this part. It's an important part of integrating change. The connective tissue, the collagen's half-life is about a year, so it takes longer for changes at this level to happen. Whereas muscles change more quickly, they bulk up more quickly, even within one use. So allowing yourself to rest with these new sensations can go toward longer term change. You're welcome to stay a little bit longer. Or if you need to get back to your day, just begin to open your eyes if they're closed. And just take your time sitting up. And this has been a good reset of some fundamental poses, so you might feel different. And just make sure you drink a little bit more water than usual today. I look forward to seeing you next time.